Good afternoon to one and all. I feel honored to welcome all in Alembic ECV webinar and warm welcome to respected sir and today's speaker, Dr. Ajit Mali sir. For further proceeding, I will hand over the session to Dr. Santosh Shinde sir. Yes, sir. Thank you, sir.
Thank you very much, Dr. Thomre. Warm evening to one and all. It is my privilege to welcome all the participants, all the field veterinarian, faculty and researchers for this webinar. I also privileged to welcome our today's guest speaker, Honorable Dr. Ajit Mali sir. So we will not take much time. We'll proceed with the introduction. All the webinar of Alembic ECV and all the collaboration with the university we used to do under guidance and motivation from Mr. P. Karunanidhi, who is Senior Vice President Sales and Marketing, Alembic Pharmaceuticals Ltd. Due to his continuous motivation and support, we conducted this financial year, we conducted 55 half century. This is 50th webinar of this Alembic CVE. And next year from Jan, we will also continue the same speed. And our purpose is to give a continuous veterinary education. That's why you can see in our webinar series, we never promote our product. We focus on the field related issues, and we wanted to give the continuous veterinary education to all the field practitioners, faculty and researchers. And so accordingly, we choose our speaker also. Now moving to our today's speaker, Honorable Dr. Ajit Mali sir. Presently, he is working as an assistant professor, Department of Animal Reproduction, Gynaecology and Obstetrics, Veterinary Clinical Complex, Shirwal Veterinary College. I will briefly introduce today's speaker. Dr. Ajit sir is very young, energetic, distinguished clinician. He is not only clinician, he is a good researcher as well as eminent extension worker. He is known in the industry or in the field for his extension work, which is he is doing from last 14 years. Sir did his graduation in 2003 and 2006 from Bombay Veterinary College, Patil. I was just 1 year junior to the sir. When sir was doing his M.V.Sc in Gynaecology, I was doing M.V.Sc first year in Bombay Veterinary College in the Department of Medicine. So I got 1 year working experience with Ajit sir. He started his career in 2007 as a livestock development officer, that is LDO, in Department of Animal Husbandry, Government of Maharashtra. In 2015, he joined MAPSU as assistant professor, Department of Animal Reproduction, Gynaecology and Obstetrics in Parbhani Veterinary College. Regarding sir's awards and recognition, sir got he is multiple recipient of various prestigious awards like Meritorious Veterinary Award in 2013 and 14, Department of Animal Husbandry, Government of Maharashtra, Young Scientist Award in 2004, that is in the symposium organized by Indian Society for Study of Animal Reproduction, that is called HISAR in Mathura. He is also recipient of Best Poster Presentation Award. The same symposium which is held in 2019, Vishaya Namakkal, that is organized by Animal Society for Study of Animal Reproduction, that is ISAR. He got Best Veterinarian Award from Animal Husbandry Department of Satara, and he has introduced ultrasonographic technique in field condition in Animal Husbandry Department, Maharashtra 2017. Regarding his clinician, I told he is not only clinician, he is a good researcher as well as extension worker. He worked as an ultrasonographic expert in Animal Husbandry Department, Maharashtra. He also worked as a state committee member for veterinary ultrasonography machine registration under PNDT Act 1994, and he introduced that the renal transrenal probe, which is used for bovine. He modified it in a simple method so it can be used in sheep and goat as a translectally. He has published near about 10 popular articles in Marathi for the dairy farmers. He has delivered 14 radio talk on here Satara, Pune, Baramati. He carried out routine various clinical, surgical health camp while working as animal husbandry department. He is very expert in equine clinical practice, especially surgery, especially is a gelding operation. Regarding his publication, Ajit sir was organizing secretary and for several conferences, seminar, and also he has.
Thank you very much. So good evening all of you and all the respected field veterinarians, researchers and dear students. So it's a great opportunity for me to interact with you regarding the different gynaecological problems and which are we are regularly facing under field conditions or in our research institute. So here I am not giving much theoretical aspects. I am going to deliver maximum practical tips regarding our gynaecological problems. We are regularly handling or we are facing different problems, and depending on that, I will share my practical experience. So that will be not that much very simple to digest to you, and it will be very much on a practical track only. So this is our prestigious institute that is located just near to Pune, and basically today's topic is regarding the practical tips regarding the gynecological problems. So mostly we are covering all three aspects regarding the large ruminants, small ruminants and the canines. So basically, so each and every aspect, so major part is the animal reproduction. So unless an animal reproduction, there is no production. So each and every species, so there is some different part, the different changes in the gestational physiology and the estrous cycle physiology. So basic thing is that whenever we are dealing with any gynecological problem, we should know the basic thing regarding the estrous cycle in each and every species, either in cattle, either in buffalo, either in sheep, either in goat, or either in companion animal, mostly in canines. So my presentation includes mostly I am delivering the basic things regarding the canine breeding management. So mostly our vets, so most of the breeding management, they are dominated by the breeders, not veterinarians. So basic thing in this canine breeding management, that is the predicting the breeding time or mating time. So in that, so very simple technique, that is the explorative vaginal cytology. Then the under field condition, how we can do the artificial insemination by freshly collected semen, and there are different mismating problems in the canines, and due to which we can handle such cases with whatever the drug available with you. Then the recent diagnostic tools for the fertility management in the farm animals, either in cattle, sheep, goat, and buffaloes. Then the estrus induction and synchronized protocols, we are all dealing with this, but I am tricking some simple methods how we can minimize the drug and we can save the productive life of that animal. Then I am delivering the some basic part regarding the 30 days pregnancy diagnostic concept in all these species. And the last part, that is most important thing, because small ruminant intensive farming, it is the emerging industry since last 5 to 10 years, and we have a lot of challenges regarding the health aspect and regarding the reproductive aspects. So all these things I am going to deliver one by one. So in the first aspect, that is the canine breeding management, as I discussed earlier, so in canine breeding, so most of the breeders, they are dominating this industry. Okay, so there are a lot of indigenous and the exotic breeds of canines, and due to which, so our breeding aspect, that is the most important thing. You all know the importance of breeding in this all these mostly in these canines, and the money they are getting by the breeders or that dog owners. So depending on that, our contribution is major. And basic thing in that, so in that breeding, so most of them, they are preferring the natural breeding. But nowadays, so whatever the male or female, they are not that much giving proper interest, or they a male having some lack of libido, or female it may be furious, due to it she will not accept the male. If there is any physical problems, if there is any anatomical problem, and mostly the psychological problem, because this male and female, they have their own psychology, and if that pet that are rearing in someone's house, they ultimately there is a lot of psychological reasons, and she will or he will not accept any either male or female partner. or any anomalies, and due to which we can't that female is unable to get mated from the male dog. And due to there are a lot of infectious diseases, they are may be transmitted due to this contagious contact with the another opposite partner, and due to which there will be chances of transmission of disease, and due to which so there is a lot of indications and advantages of artificial insemination. And the most of infertility condition, in that case either we are not knowing exactly whether there is problem in male or female. So by doing the artificial insemination, so we can get the exact idea about the semen of that male animal, and due to which if the semen is of good quality, ultimately there will be chances of getting more and more conception. Okay. So now the basic thing in this canine breeding, so mostly the clinical assessment of the optimum time of mating, that is the most important thing. So whatever the behavioral changes that we have seen from the female animal, that is there is some changes in her psychology, then there will be some changes in the vulval region, there will be slightly dribbling of reddish discharge from the vagina, and there will be some behavioral changes may be seen in the there will be attraction toward the opposite sex, or the whatever the persons available with her. Then other things that we can see, or we can confirm that animal see is a proper time in heat, because in canine estrus, so that is the 9 days proestrus and 9 days estrus. Okay, so and then that is the a tentative period that we are knowing, but there will be short proestrus and there will be the prolonged proestrus, and due to which, so if we are considering that the 9 and 11 or 13, that is are the proper days for mating, so it is not totally wrong, because in some canines or some female dog, so there is short proestrus, that female that will be having the LH surge before the 9 days, maybe 4 or 5 days, and in some cases there will be prolonged proestrus, and due to which that female that are she is not accepting their male around 9, 10 or 13 days, and she will be accepting after 15 or 17 days due to the prolonged proestrus. So these things that are the major thing in this canine breeding, and due to which, so we have the another lab methods or the hormonal estimations or the ultrasound examinations of that female animals to evaluate the exact day of mating, so that she will become acceptable or she may accept the male. Okay, so in the normal plane, so she should accept the male, and if she is not, everything is okay, but she is not accepting the male due to psychological reason or any other reason, and in that part we should go for the artificial insemination. So explorative vaginal cytology on the basis of cornification index of epithelial cells, then the proper follicular size of this by ultrasound examination, then the either you go for progesterone estimation or LH. LH is very accurate, but estimation of LH is very tedious and very lengthy process, and every half hour or 2 hours we have to take the sample and we have to check the LH, and it is not available in India, and there are some tests they are available in the outside or in exotic country outside the country, and ultimately so LH is not that much, though LH is 100% accurate, but LH kit is not that much practicable when we are we have to find out the optimum time for breeding. And also vaginoscopy is also one of the important thing for the confirmation of breeding time on the basis of crenulation of the vaginal folds. Okay, so now I am discussing the simple tricks for the defining the breeding time in these female animals. So explorative vaginal cytology, it is a very simple and easy method, and each and every one can go for this explorative vaginal cytology, and on the basis of that that vet can confirm the breeding time in that animal. Okay, so when animal is in estrus, ultimately whatever the vaginal pores, so now normally vaginal epithelial layer, there are 2 to 3 epithelial layers during the diestrus. Okay, but when this animal is in estrus, so there will be around 20 to 25 folds of this vaginal epithelial layers will be there. Okay, so in that case, so whatever the lumen due to which there will be the whatever the luminal part that will be having the less blood supply compared to the basal part. Okay, during the proestrus and estrus compared to the diestrus and anestrus, and due to which, so all this happens on the change in the estrogen level. And if estrogen level is big, ultimately there will be the positive feedback on the hypothalamus, and there will be the LSR. Okay, so ultimately when there is 100% cornification, ultimately it will be indicate that the animal is in peak estrogen, and there will be within next 24 to 36 hours there will be the LH peak and ovulation will occur. Okay, so in that case we have to just collect the vaginal smear from the anterior vagina. So this is a simple method. Just we have to go for the there are two openings in the vagina. One is the urethral opening and one is the cervical opening of root carrying toward the vagina. So in that part we have to check properly by moistening the bud, or by using the swab method. We have to insert the swab in the properly dorsal to anterior direction, and then we have to collect the smear from the anterior vagina, and just roll this smear on the right side, and then we have to make that smear dried in, and then go for any staining. Either you can go for Leishman stain, either you go for Jimsa stain, either you go for the Priest stain. So whatever the stain available with you, or what stain you are going to stain with normal blood smear, that stain is effective for the staining of these vaginal epithelial cells. And there are the four major cells that we can find out, either parabasal, intermediate, superficial, and nuclear. So superficial and cornified cells, they are the most important for us, and if cornification disease is more than 70%, ultimately it indicates that animal is in the late proestrus or early estrus. Okay, so in that case already we are confirming that animal is in proper estrogen peak, and ultimately we are indicating that within next 24 to 36 hours there will be the LH peak. So by explorative vaginal cytology we are getting the serum estrogen level, and that will be the most accurate method to confirm that animal will be going for LSR, and there will be the acceptance of the female, or mating will be happens, or the acceptability of that female to the male partner will be very soon by confirmation of this explorative vaginal cytology. No doubt, other day they are 100% confirmed, either serum progesterone or the LH, but still explorative vaginal cytology, we can find out on the basis of vaginal epithelial cells or cornification index, and on the basis of that whether there is infection inside the uterus, that can we find out by the presence of neutrophils or PMN cells. So all these things we can get in proper way by using this explorative vaginal cytology. It is a very simple technique. Just we have to calculate, we have to measure number of epithelial cells they are present, or which kind of epithelial cells they are. On the basis of that, we can determine, we can interpret our results, and we can ask the owner to go for meeting on this day. Okay, so this is a very simple thing, and this is the prime important for the artificial insemination, because before artificial insemination we should confirm that whether animal is in proper estrus or not, because basically we have to inseminate, or we have to do the artificial insemination in early estrus. Okay, so early estrus, so we have to find out by either means, whatever the techniques available with you, either vaginoscopy, either explorative vaginal cytology, either serum progesterone estimation or LH estimation, whatever the available with you and easily available with you, that we have to find out. That is the timing of insemination. Then the next thing is the semen collection. So digital manipulation, it is very much effective and the simple procedure for the collection of semen from the male stud. Okay, then the next part is the semen evaluation. Semen evaluation is also important part, because unless and until we find out there are proper individual motility or the proper live dead count, there is no any abnormality, and then that semen is fit for the insemination, and that we can deposit it by either there are three means, either vaginal insemination, either cervical insemination, or surgically intrauterine insemination. Okay, so in semen evaluation, so basic thing is that, so basic macroscopic and the microscopic examination, so that can be easily done because each and everyone having microscope. So we require the slide, we require the cover slip. On the basis of that, we can get the microscopic examination. Or for macroscopic examination, the color, volume, and the density of that semen we can check, and on the basis of that we confirm that the concentration is optimum. A minimum 300 million sperms per ml required for the conception. So mostly this by using the other microscopic examinations, either you go for newborn chambers, either you go for the US necrosis staining for the live dead count, or further confirmation of any abnormality of sperms. Okay, so all these things that is required when you are doing in the lab, but basic thing that is the macroscopic and the individual motility, that is very much sufficient when you know the proper stud and the proper male having the better fertility index. Okay, when there is any problem in the infertility conditions in that male animals, or there is no any progeny from that male animal due to number of mating, in that part we should go for the sperm concentration, live dead count, or the further abnormality of that sperm. Okay, but that is the very much required. So microscopic and the just individual motility of that semen. On the basis of that, we should go for the semen deposition. If we are confirmed that the semen is very much having the proper motility, having the proper live count, there is not any abnormality, then the semen is fit for the insemination. Either you can go for intravaginal, it is very simple. I will show how it is simple. Then the transcervical, here requires the laparoscope, special instrument is required, and the special sheet is required. And the surgical, by using the surgical incision by regular method or by laparoscopic method also we can go for, and we can directly project semen into the uterus. So first method I am going to discuss with you because it is very easy and that can be easily performed under the field condition. So this is the normal protocol we are following here in our TVCC, and this is the basic thing what we are doing. So mostly such kind of breeds, either bulldog or the other short breeds or the brachycephalic breeds. So mostly in that breed, so we require the artificial insemination. So natural mating is not that much possible, and due to which we have to go for artificial insemination in these breeds. So mostly, and also other breeds, they are not cooperating the on our partner. Okay, so in that case, so just we have to take the proper history from the male side and female side. Either here we do the serum progesterone level, we did the explorative vaginal cytology, we did the proper semen evaluation from that male side, because that male and female come from the different locations, and that we have to our challenge to mate that animal by artificial means, and we have to take the progeny from that animals. Okay, so in that part we have to go for proper quantification index, proper semen evaluation, and the also we can correlate it with the serum progesterone level. Okay, then the by digital massage or manipulation method, we collected semen. So it will take minimum 5 to 10 minutes, and there will be 3 fractions of semen in the canine, sperm fraction, sperm risk fraction, and post-sperm fraction. Okay, so mostly the prostatic secretion will be here because only the acetylenic gland present in these canines, and if we follow the proper trick by wearing the proper hand gloves while collecting the semen, and just we have to massage at the bulbous part only. We should not touch the penis, and while massaging the bulbous, within the 1 or maximum 1 minute, that female will be that male will be going to ejaculating the semen. Okay, so first fraction that we have to discard, and the latter fraction we have to collect in the either proper sterilize the glass pipette or the proper whatever the available with you. Special collecting cups are also available. So basically it will be take minimum 5 to 10 days for this semen collection in this canine. Then we have to go for the macroscopic and microscopic examination. for the evaluation of semen. Then the basic thing that what we are doing here, so simple technique we are doing here. So we are making that animal in the slanting position by lifting the hind leg, and just what AI sheet we are using for the artificial insemination in the large animals, either cattle and buffalo, same sheet we are using. There is no any requirement of either any speculum or anything to dilate or to direct that sheet. So if your basic thing or basic anatomy you are doing properly, ultimately this artificial insemination by using the simple AI sheet, it is a very much easier method, and without assisting any instrument or any speculum, we can do transvaginal, or just we are depositing the semen just near to the external os or the external cervix. Okay, so just it is a very simple method, and just we have to insert that AI sheet by squeezing, by rotating. So, and that means we are very much getting the better results by using this method of this artificial insemination. So in this video, you will see the how we are just inserting the sheet inside the vagina of that female dog by the prop making her in a slanting position, and just we have to make this proper squeezing. So it is very easy. Just like AI in case of these large animals, we have to make the 45-degree angle, then we have to make the straight, and then we are direct in forward direction, and ultimately within 15 to 20 centimeter, if our sheath is going inside, ultimately our target is achieved, and whatever the semen collected, that we have to depot, because here we are depositing the fresh semen only. Okay, so transvaginal insemination, it is very much effective when we are using the fresh semen. The frozen semen is not that much available in India. Also, there are 1 or 2 labs either in Chennai. So, but that is not that much commercial one. So when we have both partners, ultimately artificial insemination is very much effective in these canines, and it is required and it is must, because most of these things that are the very much scientific, but that are not doing regularly in our routine practice. So it is a very much and very much simple practice for the breeding management by artificial means, and just by depositing all these semen inside the female reproductive tract. So then we can remove the sheath. See here the proper sucking by the female animal, because she is in proper estrus, so the proper sucking that will be happens at that time, and just we have to make that slanting position next for 5 to 10 minutes, so that whatever the semen that will be going inside the uterus, and there will be the proper conception that will be happens. Okay, so by this simple method, so we can do the artificial insemination in such kind of this bulldog or other breeds also. So as the larger breeds also, we can do the proper insemination methods or insemination by using simple AI sheet used for our animals, that is the cattle and buffalo. Now the major problems that are facing by our field vets, that are the unwanted mating or mismating in these canines. Okay, because when there is ELS search and if there is no partner is available, in earlier cases what we see that female partner, they are not cooperative. But when there is ELS search, ultimately anyhow that female animal that will be searching the male animal, or male animal due to some pheromones, they are attracting that female partner. Okay, so in that case, so whatever the non-discrete animal or the breed other than breeds, that there will be chances of mating. So such mismating complications, they are the very much pronounced in this now in either in rural area or urban area. So in that case, so mismating complications, so what we have to do, either we have to go for, if the owner is not interested in the further breeding, then we can go for the hysterectomy. But during the distress, so hysterectomy, that is not suggested or that is not recommended. So whenever we have to go for hysterectomy, that should be done on stress only, because there should not be any cyclicity, or there should not be any hormonal changes that are going on during this either in proestrus, estrus, or the distress. So proper period for the ovariectomy when you are having any complication of mismating, or we have to go for the routine surgical procedures for the removal of this female reproductive tract. So the unstressed is the proper period. If you are doing the ovariectomy during this distress period, stress period or post-stress period, ultimately there will be complications of pseudo pregnancy, though you are removing all the ovaries and uterus. Okay, so these things, they are very common in this canine. So due to which, so we should follow the strict operative procedure during the unstressed period only, so that surgical procedure is not recommended in the mismating. Okay, then we should know the gestational physiology of gestation in that canines. So basically there are three parts. They are divided right from fertilization to implantation up to day 20 to 22, then day 22 to 42 days, that is the period of ossification, and the from period of ossification to end of participation, that is around 60 to 65 days. So in that 3 periods, so best period is the implantation to end of fetal ossification. Okay, so this period is the proper period for confirmation of mismating case and the go for the treatment only. Okay, so here there are different protocols you might know in your curriculum. So basic thing is that how to go for the induction in these mismating cases. So basic thing is that either we can pregnancy hormone, we know that progesterone. So if we are modifying the estrogen progesterone ratio by administration of the estrogen or synthetic estrogen derivatives or glucocorticosteroids, then definitely there will be the during the early stages, right from mating to before up to 4 to 5 days, if we are injecting this estradiol benzoate or estradiol barrier almost for the 4 to 10 days, then there will be chances of treating that mismating case. But you all know the side effects of estrogen. There are a lot of bone marrow suppression. There will be complication of teratogenicity and other things. So due to which nowadays this estrogen therapy is not recommended in this mismating case. Okay, then now our turns into, we have to find out the different nucleolytic approach or different approach that can be expelling this fetus or the embryos, or we can go 100% sure that there will be the abortion will be happens during the early stage. Okay, so either we can go for lysis, but CL of the canines, that is much resistant to prostaglandin. So if we are injecting the prostaglandin in any female animals, either in small ruminants or large ruminants in early gestation, ultimately there will be the abortion happens. But in canines, the corpus luteum is much resistant to prostaglandin. So there is requirement of this prostaglandin in the repeated doses. Okay, so in this repeated doses, either in 48 hours interval, we have to inject this prostaglandin at the rate of 3 to 5 microgram per kg body weight, only subcut route only. And before this prostaglandin injection, we have to give atropine and the Degra, so that there will not be any complication, because this prostaglandin will affect the other smooth muscles of the digestive tract, and there will be the shivering, there will be the vomiting, there will be the some complication may seen. Okay, but you did properly dose, that is 3 to 5 microgram per kg body weight, because in synthetic prostaglandin, so 1 ml contain 250 microgram. So accordingly, you have to calculate the dose either right from 50 microgram to 100 microgram or maximum 150 microgram, and that we have to inject subcut only. And before injecting this PGF2 alpha, we have to give atropine sulfate. Okay, and that dose we have to repeat it every 40 hours interval, either 2 or 3 times maximum. So 3 injections of prostaglandin is required for the treatment of mismating. Then another method, that is the dopamine agonist. They are inhibiting the luteotropic support, because we all know the major luteotropic hormone in this canine, that is the this prolactin. So prolactin playing the major role, and if this dopamine agonist, they are blocking this prolactin secretion, and ultimately there will be the no formation, or the CL will be going to lose her that luteotropic action. Okay, so due to either this cabergoline or bromocriptine we can use, and that can be used these tablets orally. So cabergoline is readily available in the urban area, but in the rural area, if the cabergoline is not available, then we can go for the prostaglandin treatment. Then another treatment, that is the properly anti-progesterone drug. There is mifepristone at the rate of 2.5 mg per kg orally. So that can be used twice a day for 4 to 5 days. So either anti-progesterone drug, either dopamine agonist, that is the prolactin inhibitor, or direct nucleotic agent, and the estrogen therapy that we are not going to use in these mismating cases in this canine due to lot of side effects. So here in our cases, what we are doing here in our, because we are coming in the rural area, so some drugs they are not available. So though we are prescribing now, I think in our institute, so all these drugs they are available. But when we are working in the rural area, then ultimately such things they are not that are getting at proper time, and due to which so we can use the whatever the PGF2 alpha that is available. So there are a lot of synthetic preparations of prostaglandin of different companies, they are available in the market, so that can be used, and that are very much effective for treating the or terminating the pregnancy in these animals. So this is a 25 kg body weight golden retriever having the misalliance 30 days before, and mostly we are calling the animal owner after 25 days, because unless and until we are confirming that animal is 100% pregnant, then we go for the treatment only. And mostly 99% cases of misalliance or mismating, the she dogs they are 100% pregnant. Okay, in few cases if there is not proper locking is not there, or there will be the accidental only, there will be the just information will be there, then there will not be chances of pregnancy is not there. But most of the misalliance cases there will be the pregnancy, and that we have to confirm by using the ultrasound, because whatever the hormonal injections we are injecting, they will be having some effect or adverse effect on her physiology of her overall hormonal system. Okay, so here we confirm that animal is pregnant by confirming this proper gestation sac, or by measuring the proper all these things, and on the basis of that we confirm that that animal is pregnant. Also we did measurements of this parietal diameter, count length, gestation sac diameter, so that we can correlate whether the gestation history is as per the history told by the animal owner, and whatever the findings we are getting by our ultrasound examination. So on the basis of that, so owner want to breed her, so that we try overrule the whatever the orectomy and the other protocols. So now we are going, we proceed for this DEXA and the prostaglandin therapy. Okay, so this therapy that we have used in this animal, that is the synthetic prostaglandin at the 5 microgram per kg body weight. Of treatment, because every 48 hours we have to monitor, we have to inject a prostaglandin injection. If you have the ultrasound, then you can monitor. If you don't have the ultrasound, just we have to confirm first that animal is pregnant, then we go for treatment, and just we have to monitor or ask the owner to go for the proper observation whether there is any vaginal discharge or not. Okay, so if in our cases we have ultrasound, so we are regularly monitoring this case. So same thing we did, we have examined, there is no any effect, whatever the embryos they are present inside the uterus. So on 5th day of scanning still, so on 3rd injection also there is whatever the embryos they are still alive and they are still present in the gestational sac. Okay, then after 3rd injection, so owner noticed that there will be some vaginal discharge, and after 3rd injection, so there will be see only the uterine endometrium we are seeing here only. There is only gestation sac is there, and whatever the uterine endometrium is there only, and the lumen that contain only fluid part only. So after the confirmation, we did that treatment protocol of this simple synthetic prostaglandin, that is chlorprostanoid sodium, that is readily available in the market, though they are not recommended. Most of them they are not recommended, they are not of the canines, but that is very much safe and very much effective in canines also. So we can use this prostaglandin in these animals and we get the proper results. So now we are regularly using this prostaglandin, and in combination we take the, or in some cases we are also using the cabergoline. So cabergoline, PGF-12 and DEXA therapy, it is the most recommended and effective therapy for the mismating. If you don't have the cabergoline, you can use the prostaglandin and DEXA. It is also very much effective for the expulsion of these embryos in this mismating or misaligned cases. Okay, so this is the thing that we discuss in these mismating cases. The one more thing that is noticed our veterinarians that we did overectomy, but due to this overectomy, that animal showing the estrous symptoms after we removed the uterus and the ovaries also. In some veterinarians, they are not removing the ovaries. Ultimately, that animal that are going to show the estrous symptoms because ovaries are there. Though we are knowing that animal will not become pregnant, but we did only the hysterectomy due to which ovaries are there, ovaries are active, and they are regularly coming in estrus when you are not removing the ovaries. But in some cases, what happens, most of the expert veterinarians or the leading practitioners, they did proper ovariectomy. They removed each and every part of the ovary and the uterus, but still that dog or that she dog that showing the estrous symptom, then that owner become irritated. He may take objection to you that you not did properly this orectomy, or you are not removed all this part that we must to remove in this orectomy. But unfortunately, if the smaller cells they are present, because when we are removing the ovaries, so small cells are if remaining in there, they are having the that much activity of showing the estrous symptoms, or that cells of the ovary it remains, because some fraction will be living inside when we are doing this ovarectomy. So this is the ovarian remnant syndrome that is mostly commonly seen in these canines and felines. And so just here we have to convince the owner that your dog will not be become pregnant, and such thing that will be happens. So most of the leading practitioners, they are also facing same problem. So this ovarian remnant syndrome, that will be we don't have any treatment. There is no need to go for again, because there will not be any smaller tissue part we can't remove. Okay, so just we have to skip. We have to just manage that owner. So this is happening with your dog. So don't worry, because your dog will not be become pregnant, as already we have removed the uterus and everything. So just we have to observe, and just we have to keep under the proper so that other animals that will not be attracted towards her female only. Okay, so such thing. So basically, this ovarian remnant syndrome, that is the much more complicated part from the owner side, because most of our owners, they are having the Google, and they are doing Google, and they are taking their advantage, and they are torturing us by different means. Okay, so this ovarian remnant syndrome, though you are expert, such thing that will be going to happen in each and every part. And this OHV operation that we discussed earlier, that should be carried out in only unstressed period only. Okay, so now we are turning toward the dairy industry. So whatever the part what we discussed earlier in the canine, basically artificial insemination, vaginal cytology, mismating treatment protocol, and this ovarian remnant syndrome. So this is the basic thing that we regularly facing by our vets during OPD or the field condition also. So now we are moving toward the dairy industry. So basic thing in this dairy industry, that's whatever the economics on the basis of the fertility of that animal. And the nowadays infertility problem are much either in unstressed or repeat breeding, and there will be some complications regarding the calving, and whatever the prepartum and postpartum complications are also there, either metabolic or any other complications also there. So if we are calculating the management cost when there is the infertility problem, if there is a 200 maintenance cost of that animal per day for feeding or the labor cost, ultimately 6,000 rupees required per month. And if animal is become infertile for 1 year, there will be loss of 72,000 on feeding or management only. Okay, so this is the huge loss of the farmers. So he ultimately negative in the production, and whatever the for maintenance he already spent 70,000 when that animal is not pregnant for 1 year. So calf-by-year program, or the at least 3 to 4 months after the calving, animals should become the pregnant in this cattle and buffalo. So all you are knowing the reproduction and the production properly, and if we are facing such kind of problems, so our role is major, because most of in our cases, so infertility is the major problem second to mastitis. Okay, and basically this is a multidisciplinary approach, because there are mere number of factors. So from male side, from female side, from technician side, from farmer side. So we have to go for multidisciplinary approach for the health aspect, for nutrition aspect, from the any other complication that facing by that animal. So all these things that is the how to tackle for the maximum fertility in that animal. So there will not be any worldwide common approach for the treating these infertility problems. Okay, so we have to follow our standard operating procedure. We have to develop our own protocols on the basis of whatever the available resources with you, whatever the exact conditions or exact problem they are facing on our regular practice schedule. Okay, so and the major problem is that in our Indian conditions, so almost 75% AI done by the or doing by the layman inseminator or the inseminator only. So this is the major important part, because we are not handling the AI cases and directly we are getting the infected cases. Okay, so in that case, whether there is problem in the inseminator, whether there is problem in the animal, or whether there is problem on the farmer side. Okay, there are 3 sides, so either inseminator, either cow, or either farmer. So which is the problematic, that we have to find out first. Then we go for the further our own skill by using the evaluation of body condition score, where the body condition is proper, animal is not too lean or not too fatty. Then there is any locomotory disorder, because any lameness problem, if there will be complication, or there will be animal will be become infertile. Okay, then any environmental aspects, any nutritional deficiency, or any infectious disease that we have to find out, or any production disorder that we have to find out. Okay, so on the basis of that, we have to tackle such kind of complications of the repeat bleeding or unstress on the basis of what knowledge we have, and whatever the factors, that is the cow factor, farmer factor, and the inseminator factor, that we have to tackle, and on the basis of that we can get results. Okay, so in infertility cases or in fertility management, we are not getting 100% results. If we are getting the 30 or 40% results, that is more than sufficient. So in that case, our proper diagnostic part, that is most important. Our proper way of thinking, proper way of handling of such cases, that is most important. So now basic thing is the history, then the physical examination that of that animal, that is body condition score and everything, then the vaginal examination for the specific vulval examination or rectal examination, that is important. And if any ultrasound technique is available with you, ultimately you are getting the much more hands on the treating such cases of infertility, because ultrasound getting the each and everything what we are examining per rectally only. Okay, so also it guides to us, it educates to us regarding the uterus, the ovaries, follicles, each and everything. Okay, so in that case, such thing we have to follow, such kind of when any infertility cases are there, so there should be a proper protocol should be there. What is the age of the animal, what is the parity of that animal, what is the body condition score, and all these things that we have to write, and on the basis of that we have to tick accordingly, and we have to write all these things. Then we go for the further ovarian examination by our rectal examination, then vaginal, because that is the most important thing, that we are getting something idea about that, whether there is infection or not, on the basis of color or consistency of discharge or pH of discharge, whether there is proper curving pattern. Then proper white side test we can also do, by on the basis of that we can diagnose the subclinical endometritis, and special microscopic examination is required. So this vaginal or thyroid mucus examination, that is also important, and if you have available UAG, then ultimately you will get the better fertility in our animals. Okay. Now coming toward the white side test. So it is a very simple test because whatever cervical mucus that we are getting when animal is in estrus. Okay, so nothing but cervical mucus that is comes from the endometrium, some part of cervix and vagina. Though okay, this cervical mucus that when we are seeing that animal is in estrus, that cervical discharge is coming from this vagina, and that should be touched towards the floor. Okay, or ground floor, so that should be the tensile strength, or we are considering it spin barcade is proper or having the proper nutritional content, and due to which this cervical mucus having the elasticity properly. Okay, stringiness is proper. Okay, then we have to find out the infection. So by using this 5% NaOH or KOH, just take 1 ml of this cervical mucus, 1 ml of this NaOH or 5% NaOH or KOH, mix into this glass test tube, then heat up to the boiling. If there is yellow coloration, that will be considering it as the endometritis. Okay, so whatever this yellow colorization, why there is yellow colorization, due to which whatever the neutrophils they are present inside the cervical mucus. Okay, so before this, after adding this cervical mucus with this 5% NaOH or KOH, and after heating, we are getting such kind of thing. Then ultimately, there is that animal is positive for subclinical endometritis. Okay, so it is a very simple test, and whatever the 5% NaOH and KOH that is readily available in your OPD or in your dispensary. So for such cases of these repeat breeding cases, this such kind of white side test that is easily available and it is practicable under field condition. Okay, now coming toward the advanced diagnostic technique, that is the ultrasonography, because ultrasound, it is the one of the important thing, and for interpretation of ultrasound you must know the basic anatomy, basic physiology and histology of the reproductive system. You should know the estrous cycle, how the follicular phase going, which is dominant structure in the follicular phase, which is dominant hormone during the follicular phase, and same thing in the luteal phase. You must know the follicular dynamics, how these follicular waves they are going on, and how we can manage each and everything during this estrous cycle. You should know the physiology of gestation, because you should confirm that animal is non-pregnant, because when you are confirming that animal is infertile, you are then you have to first find out that whether animal is pregnant or not, or any pathological conditions like the cystic ovarian follicle or endometritis pyometra or any gestational complication may happen. So that thing you should know. So before understanding the ultrasound image, so all these things that you should know before going for ultrasound examination. So it is the basic or routine practice that is seen in the developed countries. So each and every aspect that are monitoring by this ultrasound only. So they are very much advanced ultrasound, bovine ultrasound, they are available in developed countries, and one single-handed veterinarian they are doing regularly, and each and every part of that thing they are doing by this veterinarian only by using ultrasound. Okay, so ultrasound is the must for the managing the fertility in these farm animals. So such thing that we had obtained in our Indian conditions also. So that is also required, but we have some limitation. I am not considering that each and everyone having ultrasound machines, but now in our state around 200 machines they are available under field condition. So also in some state also, so whatever our state policymakers or our administrator, they are thinking about purchase of such machines. So that is requirement for the managing the fertility in this parliament. So regarding this, regarding the subclinical endometritis or the diagnosis of any infertility condition, so we have to examine the proper uterus and the both ovaries. So for that reason, so you should know. So major part of this uterus, that is the endometrium. Endometrium that playing the major role during the estrus and during the pregnancy. Okay, so whatever the carancles, they are from the endometrium only, and whatever the early part of the embryo that is during the estrus, and the early part of the embryo that is development that is going inside the endometrium only, or whatever the uterine milk that is secreted from endometrium only. So endometrium is proper, ultimately animal having the no any complication for maintaining the pregnancy, because when we are doing the insemination, if proper insemination is there, ultimately 90 to 95% animal will be become pregnant. Okay, fertilization will be there, not considering the pregnant. We are considering it the 90 to 95% animal that become the fertilization will be there. But when that fertilized ova or zygote that comes inside the uterus or in the endometrium. If the endometrium is not proper, if there is any infection, ultimately that there will be the chances of early embryonic death. Okay, so around 6 or 7 days or maximum 8 days that embryo coming in from the fallopian tube to uterus, and if the endometrium is not proper, endometrium having the infection, ultimately that embryo that will be going to die. Okay, so that will not be fit for the environment is not proper, and due to which animal having a lot of stress, and due to that stress condition also or some infection also, so there will be complications seen inside the uterus or in the endometrium, and that there will be early embryonic. Still, there is no any test for diagnose the early embryonic death. How we can diagnose early embryonic death will be happens or not. Okay, so only the thing is that if there is the short cycle or the longer estrus interval, then we can assume that there will be complication inside the uterus male. We are not 100% sure. We don't have any assays to diagnose that there is a complication of early embryonic death. Okay, so on the basis of endometrial wall thickness, by using this ultrasound technique, we can get the idea about that endometrial thickness is proper or not, either hypertrophic or not, and on the basis of that, we can get this idea about the subclinical endometritis or endometritis. Okay, so uterine environment is the major part for this fertility in these farm animals. Okay, so such kind of uterine endometrium we can easily locate by using ultrasound technique. Now coming towards the ovaries. So for the ovaries, just we have to know the proper shape, proper the anatomy, histology of the ovary and the diameter of the ovary. We should know the normal ovulatory size of the graphite follicle and how the follicle contains and what is the histology of the corpus luteum contents. Okay, and what is the size of the ovary during the anestrus, during the estrus, or during the repeat breeding animals. Okay, so this thing we should know properly. So normally the ovulatory size of the graphite follicle in this catenary buccal, that is 11 to 18 mm. It depends on the parity, it depends on the breed, and depends on the exotic levels. Okay, so normally this is the 11 to 18 mm, 1.1 to 1.8 centimeter. That is the normal ovulatory size of this graphite follicle. And if there is any pathologic conditions, mostly the cystic ovarian follicles, or we are saying the cystic ovary. Nowadays we are not we have to say the cystic ovary. It is the cystic ovarian follicle because it is the disorder of follicle only. Okay, so it is either of luteal cyst nature or follicular cyst nature, depending on the cyst wall thickness. Okay, so if this follicle that is moving or having the size more than 20 mm or 2 centimeters, it is considered as the cyst or cystic ovarian follicle. And if the cyst wall thickness it is more than 3 mm, it is luteal cyst, and the less than 3 mm, it is the follicular cyst. Follicular cysts mostly they are multiple, and luteal cysts they are mostly single. Okay, so basic thing is that size of the graphite follicle that we must know when we have to compare with the pathological condition. If animal is having the normal ovulatory follicle, then we should rule out that there is no any cyst. Okay, so for that reason, we have to differentiate whether normal primary follicle, secondary follicle, tertiary follicle, and graphite follicle with this pathological cystic ovarian follicle. Okay, so for that reason, basic thing you must know. So this is just when we are doing the ovarian examination. This is the CL slightly hypoechoic than the ovarian stroma, and this is the anechoic follicle. Okay. Then this is the graphite follicle. So this is the normal graphite follicle. We are measuring that around 12 to 18 mm. That is the normal ovulatory size of that graphite follicle. So totally follicle is contain fluid. So it is anechoic round follicle will be there. Graphite follicle will be there when animal is proper estrus. Okay, when we are to examine the proper infertility conditions, so in that case, we have to check the proper endometrial wall thickness, we have to check the proper graphite follicle or any previous CL, regress CL or not. So on the basis of that, if the endometrial wall thickness is more than 8 mm, so it will be having some minor endometrium, having the infection, and whatever the CL is comparatively larger size, so that there will not be fertility will not be there, pregnancy will not be happen when we are doing the insemination. So in such cases, we have to rule out that animal. Either we skip that estrus, either you can inject the intrauterine, or we can induce the estrus after 8 or 9 days. Okay, so now coming toward this follicular or luteal cyst. So this is the one ovary, and this is how this second ovary having the cystic condition. So same thing, either in follicular cyst, cyst wall thickness is comparatively less and compared to this luteal cyst. Okay, so at least we have to differentiate this Graafian follicular cyst and the luteal cyst, so that we can differentiate whether animal is okay. So basic thing is that uterus and the ovary that we have to roll out properly, we have to examine properly, and then we can proceed for the further treatment. In some cases we require very less treatment, and in some cases we require specific treatment. Now coming toward the pregnancy diagnosis, what are the importance of pregnancy diagnosis in these farm animals or in dairy animals? Because it is nowadays we are giving the only complementary services to the farmer. Okay, because farmers is not knowing the importance of pregnancy diagnosis, early pregnancy diagnosis, and we are not knowing the our value for confirmation of pregnancy earlier days. Okay, so we all know that our conception rate when well-known gynecologist or well-known field practitioner when doing the insemination, so there is a maximum 40% conception will be there. Okay, so 60% animal will be coming non-pregnant. So our target is that how we have to diagnose non-pregnancy earlier instead of pregnancy. Okay, so our interest should be that we should diagnose earlier the animal is non-pregnant. If animal is pregnant, well and good, but animal is non-pregnant, then we can go for treatment on the basis of what is the exact complication seen inside the uterus or the ovary. Okay, so basically most practical application in the veterinary ultrasound, that is the diagnosis of non-pregnancy earliest. Okay, so non-pregnancy, it is the most important thing to diagnose, so that we can minimize, we can reduce the imperative problems in these farm animals or in dairy animals. And nowadays by ultrasound, 30 days, that is the most appropriate period to diagnose whether animal is pregnant or not pregnant, 100% by examining the embryonic vesicle, embryo and embryonic heart. Okay, so if we are confirming on day 30, ultimately nowadays what we are regular practicing, or farmers they are asking to go for pregnancy at around 3 months. Okay, so here we are reducing 60 days, and if we are calculating the 200 rupees per day, so ultimately we are saving almost 12,000 rupees by saving the 2 months only. Okay, so just in this is the 29 days pregnancy, so here proper amniotic membrane, this is the embryo, and proper embryonic vesicle is there. Okay, so on 32 days, such kind of embryo that we can see properly. So when we are performing this ultrasound for pregnancy detection at around 30 days, so there should be proper embryonic vesicle, and inside that embryonic vesicle there should be proper embryo, and at the center of the embryo we are getting the proper picture of the heartbeats. Okay, when gestation progress around this is the 40 days, then the proper organism will be going to happen. So after 45 days, there is no need of ultrasonography. Okay, so for that period, earlier we have to confirm that animal is pregnant or not on the basis of embryonic vesicle, embryo and embryonic heartbeat. Okay, so why this concept is required for 30-day pregnancy? Okay, so as discussed earlier, 40% maximum conception rate for each and everyone. Then whatever the animals, some animals may coming in estrus after 21 days. Some animals may coming estrus after 42 days. Okay, but almost 30 or 40% animals they are not showing the estrus, and that animal we are going to check after 90 days or 100 days. Okay, so for that reason, so those animals they are not showing the estrus after 21 days, that can be considered for pregnancy diagnosis at day 30. If ultrasound machine is available with you, or if a machine is not available with you, you can procure or you can demand to your government officials, or if you are in private, you can go for the purchase of such machines. But pregnancy can be confirmed on the basis of such things as the physical, embryo proper, embryo carpet, and the corpus luteum. Okay, so by using this ultrasound pregnancy diagnosis at day 30, so that is the most practicable method to reduce the infertility problems in these farm animals or mostly in these dairy animals. And when animal is non-pregnant, then on the basis of what is the structure present on the ovary, what is the complication inside the endometrium. If endometrium is okay, ovary is okay, then within the required drug, if ultimately on day 30, because you know the estrus cycle, if we are knowing the estrus cycle, animal has to come after 21 days in estrus. But in some animals, they are coming in estrus, they are not exhibiting the estrus symptoms. So mostly silent heat, that is the sub-estrus, that is the major complication in our dairy animals due to lot of stress, either environmental stress, nutritional stress, or man-made stress. Okay, animal is coming in estrus after 21 days, but not shown by the animal, or farmers unable to diagnose that animal in estrus. Okay, when we are confirming that animal after when we are going for confirmation of pregnancy on day 30, animal is not pregnant, but animal is cyclic. Okay, because earlier graphene follicle was present on the left ovary, and now if the CL is present on the right ovary, ultimately animal is not pregnant. The earlier previous cycle follicle ovulated from left ovary, and now we are getting the CL on the right ovary. Ultimately animal is not pregnant. We scan the uterus also, and if there is no infection is there, ultimately by using prostaglandin, because the cyclic CL is there, because cyclic CL, the CL in between 6 to 16, that is the receptive to prostaglandin, and that CL that will be within single pitch injection we can inject, and on the basis of that we can induce the animal in estrus within next 2 or 3 days. Okay, so if we are diagnosing the 30 days pregnancy, animal is pregnant, well and good. If animal is not pregnant, we are getting CL, we can inject PG. If animal not having CL, on the basis of either it is requirement of hormone, if there is requirement of only ovarian massage, or if there is any intrauterine therapy of leukocytin or anything, that we can incorporate, and that we can bring that animal earliest in cyclicity, or that animal may become pregnant within next 1 or 2 cycles. Okay, so here I just given the example about how if we are saving the 60 days and if we are calculating the management cost of 20 liter cow, then ultimately, so we are saving 18,000 if we are saving the 60 days, and if we are confirming the pregnancy on 60 days by parental only, then we are going to save the 9,000 only. So we should not give the complementary service to the farmer for early pregnancy diagnosis. We have to charge properly, because we are saving such huge amount, and we are reducing the infertility problems in our farm animals or our dairy animals by our proper diagnostic approach. If you have ultrasound, you go for 30-day pregnancy. If don't have ultrasound, you go for the 60 days pregnancy, and on the basis of that, we are saving such kind of infertility problems in our farm animals. Now coming toward the estrus induction protocols, I am not going deep in these estrus induction protocols, because you all know that there are different estrus induction protocols they are available, and all these estrus induction protocols, they are on the basis of the estrus cycle, either follicular phase or luteal phase, which animal is in either cyclical or non-cyclical. Okay, so in that case, so basically, so we have to tackle the either delayed puberty or the pre-pubertal anestrus, or post-partum anestrus, or post-breeding anestrus. So there are these 3 things, and we can categorize either there is functional tear present on the ovary, that is animal is cyclic, and true anestrus, that is smooth ovary, and the animal is totally not having any functional CL or the graphene follicle present on the ovary, that is comes under the true anestrus. Okay, so there are different means for the induction of estrus in these farm animals. So mostly, as we discussed, there is huge economic loss due to this infertility or anestrus or reproductive problems. So there are different hormonal and non-hormonal approaches. So both things that we have to think. Okay, so there are different heat inducer bolus or tablets or capsules are available. Some mineral supplementation or area specific mineral supplementation is also most required. Then the uterine or ovarian massage, that is the most important treatment, and local iodine treatment also available. And some hormones there we are knowing that. So estrogen, that is not, we are not using, but progesterone, GnRH and prostaglandin, they are common. Insulin and antiprolactin drugs also available, but they are not much important compared to this prostaglandin. Nutrition and environment is proper, we can manage by using uterine and ovarian massage. if required some estrogen capsules or tablet, ovarian massage, or if you use leukocytes, and in some cases we require the hormonal preparation. Okay, so regarding the non-hormonal preparation, so gentle massage of the uterus and ovary, that is the most important thing, or we can use this counter irritant, that is leukocyte. So leukocyte is the one of the wonderful drugs, and that we can use for the stress induction. It can be used for in repeat cases. Okay, for it can tackle with the unstressed animals, and it can tackle with the repeat breeding animals also, and it is a wonderful drug, and that we have to there is no any market preparation, that we have to ready preparation, that we have to prepare, and that we have to use. So dilution rate, that is most important thing. So this is what, that is this is the stock solution, and 1 ml, that is stock solution. Either you can take 25 or 40 ml distilled water, that will become 1:25 or 1:40, because 1:40, that is the proper dilution, and that can full that animal 20 or 30 ml, and that it can be tackled for unstress and the repeat breeding complication. Okay, so it is just uterine irritant, and that increases the blood supply, and that triggering the hypothalamus to release the GnRH, and animal showing the stress symptoms. So Lugol's ideal, it is a wonderful drug under pill condition. So now coming toward the hormonal protocols for stress induction, I am here discussing only the prostaglandin and progesterone. So whatever this prostaglandin, progesterone, so that are work for the stress induction or stress synchronization. Okay, so in single animals we are doing stress induction, in group of animals we are doing it is a stress synchronization. So here we are eliminating the need of stress induction, major problem under Indian condition, because in developed countries their heart size is around 500,000, 5,000, 10,000, 10,000, 20,000. They have CCTV, they are having the pedometer, they are having each and everything. Okay, but in our Indian conditions, our animals, they are stall fed. Our animals having size of 2, 4, 5, maximum 10 or 20 animals, they are reared by our farmers. Okay, so here the stress detection is the major problem in our Indian conditions. Okay, so for that reason, so if you are using such hormonal treatment, and if you are doing the fixed time artificial insemination program by using single PG, double PG, or this different progesterone based or GNL plus prostaglandin based protocols, ultimately we are getting the better results. So now coming to the prostaglandin. So prostaglandin is very, if the CL is present on the ovary, 6 to 16 days CL and that estrous cycle, so that will be the receptive to this prostaglandin injection. So dose rate is very simple in this Dynapro, 25 mg required, 1 ml contain 5 mg, so 5 ml injection of natural prostaglandin is required, and 2 ml, that is chlorprostranol sodium, 500 microgram, it is available in the market. Now the D-chlorprostranol is also available in the market, so that will be only 150 microgram is dose is required. Okay, so natural prostaglandin, synthetic chlorprostranol or D-chlorprostranol now available in the market, and also we can use the intraoral submucosal. It is not that much recommended because we have to inject intraoral submucosal route. We are reducing the dose, but there is a lot of complications. Here I am showing the just practicability how we have to inject. If the left to sleep, the here the CL is present on the left ovary. Ultimately, we have to inject the IVSM on the left side of the vulval lip. Okay. Now coming toward this prostaglandin, there is the mostly the intravaginal devices, they are available. Earlier ear implant or the other routes are available, but intravaginal, either cedar or the breed, they are available in the market. There are some restrictions, but mostly this IVF or the ETT recipient or donor, they are using these progesterone based protocols intravaginally, and they are having the better results in these non-cyclic or the true unstressed animals, or do the in cystic and conditions, either follicular or luteal cyst, they work very well, and this is required for the treating these infertility cases. So here just we have to carry out the routine parental examination in these animals. We have to rule out the uterus and the ovarian activity, and then we should go for the intravaginal application of this control internal devices, progesterone. Okay, this progesterone, this is the just cedar. Just you have to just wash or just clean with the betadine. Then this by using this applicator, this specific applicator, they are available. Then this is the T-shaped devices, so that if we are removing that, that will become T inside the vagina. So just we have to take proper precaution. We have to make proper sanitary procedure, proper wearing of the gloves. That is most important thing, because progesterone may absorb through skin. Then clean the vulva properly, and vaginal mucous membrane also properly, and then by making the 45-degree angle, just like a AI gun we are inserting, just we have to hold the proper both vulval lips, and then just insert this intravaginal device or the applicator inside. Just by pressing, just remove the applicator, so that whatever the device or this progesterone device that become that remain inside for the next 7 or 9 days. Okay, so it is a very simple procedure to apply this intravaginal devices, either feeder or the feed. So it is a very simple thing. So proper precautions of ourselves by wearing proper clothes, then the proper cleaning of vulva and vagina, that is a must. And on the basis of that, we can easily insert a number of animals hardly within 5 or 10 minutes. We can insert by per rectal examination or to insertion we can do within 5 to 10 minutes only. Okay, so it is very much. So this progesterone, just I am giving just mechanism. It creates the negative feedback on the hypothalamus. It is artificial CL, and after removing the CL, that means the CL is removed, and whatever this stored GnRH, that will be giving the flow to release the maximum GnRH. So after removal, just hold this by this whatever the thread, blue color thread, and then inject the betadine, so that there will be mild endometrial vaginitis will be there. So that can be infused only intravaginally. There is no need to insert into the uterus. So intravaginally, so we treat this minor vaginitis that can be treated by injecting this, and after 48 hours we can go for fixed time insemination, or by exhibiting the estrous symptoms or observing the estrous symptoms, we can go for the insemination. Okay, so we can use the single PGF-TOLPA. We can inject GnRH in combination with you. So depending on the condition, because each and everything ovarian condition that we have to check properly, and then you decide whether you go for single PG, you go for GPG, you go for the progesterone-based protocol. So there are n number of protocols available in the market, but depending on your requirement, unless and until you go for follow the properly ovarian and uterine examination, you didn't go for any blind treatment. Okay, because hormones, they are having the side effects on the animal health, so that use the appropriate hormone and the required quantity, and so that you will get the better results. Okay, so last part we are going to discuss in the small ruminants, because whatever thing we are seeing in the dairy animals, that thing that can be adaptable in the small ruminants. Okay, so we are considering that these small ruminants, they are the seasonal breeders in our tropics or subtropics. So it is totally wrong. So in tropics and subtropics, we are coming in subtropics. Ultimately, they are the cyclic throughout the year. Okay, so we are considering what we are studying in the our college life, that we are getting that the sheep and goat, they are the seasonal breeders. They are having the photoperiod activity, because in subtropics and tropics, so there is no that much photoperiod, or true photoperiodism is not seen in these animals. No doubt, in short day, the maximum pregnancy or maximum estrus will be there, but throughout the year, that sheep and goat, they are showing the estrus sector. Okay, so nowadays we have some limitations. So in large ruminants, we can go for rectal examination, but in small ruminants, we have some limitation. We are unable to find out the ovaries. We are unable to find out the uterus. But by using ultrasound technology, by rectal approach, we can get the proper ovaries by proper uterus, and on the basis of that, we can get whether it is having the infection or not, endometritis or pyometra, or the mucometra hydrometra complex is also much common in the goat, and most of the cases they are undiagnosed, because we all know that if goat is not become pregnant, having a complication, directly we are that farmers that are directly selling to the slaughter. Okay, so most of undiagnosed cases, they are seen under field condition, and for that reason we should have a proper approach to know the ovarian and uterine status, to get the proper idea about the uterus and ovaries and on the basis of that we can get the proper idea about that whether that sheep and goat either in estrus, either in cyclic, or either in diestrus. Okay, so just like large animals, we discussed that 11 to 18 mm, that is normal old size of graph and follicle. In sheep and goats, it is around 7 to 10 mm or up to 1 centimeter, that is the old size of graph and follicle. Either 1, 2 or 3 follicles may ovulate, and accordingly we are getting that much, one single or triple pregnancy also. Then also the cystic ovarian follicle, they are also common in this sheep and goat. So in last 2-3 years, we get around 10 to 12 cystic ovarian cases in this goats also. Okay, so same thing, same pattern. You should know the physiological ovulatory size of graph and follicle and cystic ovarian follicle, so that we can differentiate it. Okay, so ultrasound is having the major thing. So here how we are modifying this ultrasound probe, rectal probe, in this whatever this probe that we are regularly using in this large ruminants. So here we are modifying this probe by using this AI sheet only. Okay, so this AI sheet, just we are making this probe rigid so that we can't insert our hand inside the rectum of this small ruminant due to the size of that or due to less size inside the rectal cavity. So just by using this texture tape or the just micro tape, so we can just making, or we just two AI sheet we are using here. Every time we are using the fresh AI sheet so that there will not be any chances of infection from one animal to another animal, and such kind of thing that we have to follow properly. So if that probe become rigid, ultimately that is we can monitoring or we can examining the ovaries and uterus external. Okay, so it is a very simple thing that we can monitor with that. So it just here we are sitting in comfort, and just we have to proper wearing the gloves. We have to insert that rigid probe inside the rectum, and we can monitoring the uterus and ovaries by just like in large ruminants also. Because ovary and uterus, that you have to find out properly, and if you are getting proper idea about the ovaries and uterus, ultimately we are getting the proper treatment approach. Whether animal is pregnant, if animal is not pregnant, then there is any complication of either ovaries or uterus or anything that we have to find out. Okay, so this is thing. So this is our routine practice, or why these small ruminants, or why this semi-intensive farming that is very much popularized, and due to which our veterinarian's role is more, because in these animals they are having the such kind of loss, they are rare, and they are traveling from 50 to 200 kilometers to scan only pregnancy diagnosis or having the infertility problems. Okay, so if you have facility, ultimately these owners can attract with you, and we are getting the maximum such kind of cases of complications of the ovaries, complication of uterus, and we can diagnose, and on the basis of that we can treat, and accordingly we are getting the better results. Okay, so this is just like that. So this is the bladder, just cranial bladder, we are getting the uterus. So it is a non-pregnant uterus, and this is a proper endometrium inside the by using this transrectal approach in this goat. Okay, so this is a simple thing. It is in single plane we are getting the proper uterus, ovaries, and the bladder. So bladder we are using the contrast for getting the proper location of the uterus. So here we can take proper, we can compare this ovary having the CL, this ovary having the only follicles only. So if this animal is not pregnant, ultimately a single PG injection. So whatever the 500 microgram is required for in case of large ruminants, only 75 to 125 microgram is required for injection of estrus in this small ruminants. Okay, CL can get lice, and we are getting the animal in estrus within next 2 to 3 days. Okay, so this is the case of follicular cyst or cystic ovarian follicle. See the size of this follicle, cystic follicle, and the cyst wall thickness is also around 0.14 centimeter, and due to which we are confirmed, and on the basis of by injecting the treatment of either GPG protocol or progesterone based intravaginal devices are also available in the sheep and goats. So that is most effective treatment for treating this cystic condition in these small ruminants. Okay, so the pregnancy diagnosis is also much important thing in small ruminants, because for we have limitations unless and until animal is 3 months pregnant. By abdominal development we can diagnose animal is pregnant. Okay, so here we can diagnose from day 24 only. Okay, on day 24 there is proper basically embryo is proper, embryonic heartbeat will be there, and whether animal having the proper gestation depending on the size of the embryo. So it is 30 days. So here we are getting the proper amniotic membrane, embryo, embryonic movement, embryonic heartbeat here. Okay, that we are getting properly. Now coming toward the complications. The hydrometra and mucometra complex, this is the more complex, common problem in the these small ruminants, and only the after having the proper history of breeding that animal, that only the accumulation of fluid inside the uterus only, either watery or either mucus. On the basis of that, we can differentiate it as a hydrometra or mucometra. But such things they are most common in the dog, these caprines and ovines, and that can be treated if we are diagnosed earlier. We can inject prostaglandin, we are getting the better results. So same thing regarding the pyometra also. Post-breeding pyometra, because we don't have any option, but such kind of only the hydrometra and mucometra we can differentiate with the pyometra, that here the ecogenicity of fluid is completely hyperechoic. Okay, so we can diagnose. So treatment will be same for the pyometra and hydrometra. Here we can we have to use the antibiotic along with the prostaglandin. So 2 doses of prostaglandin at 11 days apart, and the antibiotic it is required for the treating such cases of hydrometra, mucometra or pyometra, because it is the most of undiagnosed case, and that we have to treat as per our 100% confirmation. Okay, because 100% confirmation we are getting by using only and only by using ultrasonography technique. Okay, so now we are coming to conclude our today's talk. So basically the infertility is the major problem with each farm animals and companion animals. Okay, so if we want maximum profit, our farmers want maximum profit, there should be proper fertility. They're having the proper having the good reproductive efficiency, and if having the good reproductive efficiency, ultimately that farmers will get the more profit. Okay, so for that reason, so early pregnancy diagnosis as well as non-pregnancy, because non-pregnancy diagnosis is not, we don't taught anywhere. Okay, so diagnosis of non-pregnancy earlier, that is a major important part in reducing the infertility problems in the farm animals. Okay, so I am always suggesting, or always giving more intention to our student that you should focus on non-pregnancy, because early non-pregnancy is one of the important tools to confirm or reducing the infertility problems in our farm or companion animals. Okay, so now if you are doing field conditions, ultimately you require the advanced diagnostic technique, because ultrasound that is must in future days or in present days also, because it is a very much old technology, right from 1990 in foreign countries or developed countries they are using. And if you want results, so we should have such kind of advanced technology under field condition. So coming toward the hormonal protocols, they are best for stress induction, because most of undiagnosed cases we can treat that animal and it is simple. But our per rectal palpation is most accurate. Should be whether you have to use only PG, whether you have to use double PG, whether you have to use along with GnRH. So on the basis of ovarian palpation technique, what we are palpating by your hand, whether you are getting proper CL or not, then you go for prostaglandin. If you are not getting CL, you go for the GPG, or we can use for non-hormonal protocols also if everything is okay. Okay, now coming toward the ultrasound, it's very safe, very easy, economical, practical way to confirm animal pregnant or non-pregnant, each and every animal species, either companion animal or farm animal species. So 30-day pregnancy, it is very much needed in nowadays in present scenario, and each and every institute should have the ultrasound technique for the fertility management, because this ultrasound have the wonderful tools to diagnose the infertility problems. Coming toward the last, that is the canine breeding. So it is the most important part, and most of our vets they are neglecting the breeding, and the breeders they are dominating this industry. Okay, so canine breeding should become forward. So whatever the breeding time management or the mating time on the basis of this vaginal cytology, because if we are sending the lab sample to the lab, ultimately our role is over. They are getting the progesterone level and they are suggesting accordingly. But that you are doing regularly the cytological examination, ultimately we can get the proper idea about that. Owner will become to us, follow us, and accordingly we can suggest, and accordingly he may come for the further pregnancy or the further complications of any whelping or any dystocia complications. Okay. Artificial insemination also is a major and important task, and the why it is important. It's a very simple technique, but vaginal insemination, what we are doing here. So almost through our 3 inseminations we are doing every month. So ultimately, yearly around 20 inseminations we are doing every year in our institute. So that this is most of breeders or the most of these animal owners, they are in this breeding business in canine industry. They are attracting that part, the conception rate they are getting by using this artificial insemination technique. Okay, so canine breeding, dairy breeding or management, or these small ruminants. So each and every species is important for us. Being veterinarian, we should dominate, we should have a proper approach to tackle all these complications regarding the gynaecological problems that are facing by the farmers, and ultimately our role is more. So I am again very much thankful to Alembic for giving the chance to interact with you with all of you, and whatever the practical things I just discussed with you. So again, thanks to each and everyone, to audience and Alembic team for the giving me this opportunity, and I am again thankful to kind lectures I delivered since last 80 minutes, so that will be fruitful for you in your future practice. So thank you.
Thank you very much, sir. Indeed, this is a very excellent presentation, sir. Practical and applied presentation. You can see instead of question answer, the chat box is completely full of the appreciation for the presentation. Now quickly we'll go through some of the questions, sir, which is asked by our participant. Okay. Dr. Naresh Kulkarni will take the question answer session, followed by vote of thanks.
Thank you, sir.
Yes, sir.
I'll be presenting some of the questions during your talk. The participant has asked, how many days after mismating the oral medication can be done for the abortions, particularly for the bitches, as you started your presentation from the small animals like dogs.
So basically what we discussed earlier, so whatever the mismating treatment, that starts after the 25 days, after confirmation of pregnancy. Either you have to go for the cabergoline or bromocriptine. Okay, so that we have to use after 25 days only, after confirmation of pregnancy. So safest period, that is 22 to 42 days after nidation after implantation to ossification period. So 25 to 30 days, that is the best period, and that cabergoline 5 microgram per kg body weight daily for 5 or 7 days, that you can use, or bromocriptine if you use, or antiprogestin if you, mifepristone if you are available, so that you can use accordingly. Okay, so whatever the oral medications you have to use that after the 25 days after the confirmation of pregnancy only.
Thank you, sir. So the question is, what is the proper time of when the bitch came into heat? So,
okay, earlier I discussed that the animal having the long or short proestrus. So accordingly, we have to confirm that animal is in which stage. Okay, so we have to go for mating in early estrus only. Okay, and the bitch or sea dog also receptive in that period only. So we should know either by using the exploratory vaginal cytology or progesterone level. Progesterone level should be around more than 5 nanogram per ml serum progesterone level, or quantification should be more than 80%. Okay, on the basis of that we can decide whether animal is having the proper mating time or not. Okay, so by external observation we couldn't find out anything. So by either exploratory vaginal cytology or serum progesterone estimation, we can confirm that the proper time of mating is there.
One more question by Dr. Rushikesh linked with this mating itself, that can you skip the first heat before mating?
Yeah, it depends on whether animal having the proper body weight or animal having the proper health. Then you can't. There is no need to skip the first aid. So if the 1 year is completed, ultimately you go for the mating. Or in some cases there is not proper growth of the body or the body weight is not proper or appropriate, then you can skip the first hit and you can go for the wait for the second hit and then go for mating.
Yes, thank you, sir. There is one question regarding this thyroid involvement in delaying the heat. So, is there any role that
it is
thyroid is playing?
Very tough topic, and that will not be fulfilling in this very short time. And I should have some reading in that. But thyroid it is required for the overall growth of the hormone, and after the growth of that, that animal become the sexually mature, because the growth hormone and then thyroid hormone and then the sexual hormones, whatever the gonadotropin they are having the role. So thyroid having the role, but depending on that you have to proper estimations of this for the thyroid and each and everything.
Okay, thank you, sir. So the next set of questions are: can we differentiate luteal and follicular based on the ovary palpation in the field conditions? The question is,
so depending so by luteal and follicular cyst, depending on the consistency. So some follicular cyst they are having comparatively larger size. So both ovaries we can get the cyst. In that case, we confirm that it's the follicular cyst, and luteal cyst comparatively having the thick consistency. So and it is the comparatively single one. So on the basis of that, we can differentiate follicular or luteal cyst. But basically, treatment is same. Whether you are going for confirm, you don't have any advanced diagnostic tools, so treatment protocol is same, because earlier we are considering that for luteal cyst we go for prostaglandin, and in follicular cyst we go for GnRH or LH. But nowadays, so same protocol is there, so there should be a proper luteinization of cyst, either luteal cyst or follicular cyst, so that you go for the 20 microgram GnRH. Okay, then after 9 days you go for the prostaglandin. If you have the cedar, progesterone-based cedar, ultimately you can insert along with the GnRH injection. It will give the better results. So on the basis of multiple cyst, we can confirm it is follicular cyst and thin wall of the follicular cyst, and luteal cyst by using thick wall only, and single cyst will be there.
Thank you, sir. So there is another question asked by Dr. Alka, that how much days pregnancy can be diagnosed accurately by the per rectal examination if we compare it with the ultrasonography? That's what her question is there.
No, it depends. It depends. So depends on the your own rectal skill and how much animals we have earlier diagnosed or the palpated. So it depends. So in hippos you can easily get the symmetry up to 35 days. Okay. So if you are regularly doing the ultrasound, then you can get the proper slippery fill at 30 or 32 days. So it depends on your hands-on. So how much animals we have diagnosed or how much animals we have performed at that specific period. So it is your interest to diagnose number of cases so that you will get the accuracy maximum. But 45 days or 50 days, that is the earliest to diagnose by per rectal examination only.
Thank you, sir. So there is one more question. Dr. Muthu Ramalingam, he's saying that luval siding is not recommended in first conditions. He want to know just why.
No, basically what saying the first condition means that is the chronic condition. So in chronic conditions, so we require the antibiotic also, we require the local administration of antibiotic also, and parental antibiotic also. We have to, if there is CL, we have to use the prostaglandin also. So in that case, the luval siding not having that much role. So luval siding having the role in the subclinical endometritis or endometritis, or it can be used for the estrus injection as it is a counterreactant to uterus. Okay, so as it is a chronic condition, so luval siding alone that will not be working, or that can be not be used in this pyometra cases also.
Thank you, sir. The last question that how to convert the rectal probe usable for small animals.
Yeah, I think in presentation, I think I shown that video. I think that video is visible to all. So
Yes,
so by using this either AI sheet that we are using for this artificial insemination that can be used, or PVC pipe, half-inch PVC pipe that are used for the fitting that we can break in between, and that can be become made by making rigid one. So either PVC pipe or this AI sheet that can be very much useful for the making this probe rigid, and that can be used for the rectal examination in this small ruminants.
Thank you, sir. These all
Yes.
were the questions being asked by the field veterinarian. Thank you very much, sir. Sir, now I would like to, I'm privileged to share the vote of thanks on behalf of Alembic Pharmaceutical. So good evening to one and all. What a knowledge enriching session it was. On behalf of Alembic Pharmaceutical, myself, Dr. Naresh Kulkarni, would like to thank Dr. Ajit Mali sir for sharing his practical experience on gynaeco-clinical problems under field condition. Definitely, sir, your presentation will benefit the numerous field veterinarians as well as the postgraduate students who have joined as a participant in this webinar. Also, I would like to thank all the participants who have shown their keen interest and take out the time to be present in the webinar. I would like to thank our Senior Vice President, Mr. P. Karunanidhi sir, for his constant guidance, motivation, encouragement to organize such a useful webinar for the benefit of the veterinarian. Also, I would like to thank Dr. Santosh Shinde sir, Dr. Rajesh Sharma sir, Dr. Sanjay Latkar sir, Dr. M.V.Sc, and Dr. Gangadhar Thomre. Also, I'd like to thank all entire Alembic field force who has wholehearted support, given support to make this webinar successful. Also, lastly, I'd like to thank everyone who has directly and indirectly helped for the smooth conduction of this webinar. Thank you, one and all. Thank you.